professor of psychiatry from Rochester, and he's the dean of the medical school admissions on all three campuses. And Dr. Bostwick has one of the more interesting backgrounds. He has a BA in art history from Yale, a BA in zoology from the University of Hawaii, and then started his pediatric residency at Harvard and did his psychiatry residency and fellowship at Harvard. So really an interesting person, and we're really lucky to have him here.
Okay, well, my fellowship was in consultation liaison psychiatry, which is for psychiatrists who spend a significant proportion of their time working with medical and surgical patients, and delirium is bread and butter. And I'm going to use the analogy of the canary in the coal mine. I do not know if this is an EPA-approved canary or if Dr. Pruitt would have anything to say about it, but for our purposes, you all know about the canary, that old-time miners would take it down with them into the mine because the canary was more sensitive to things that might harm the miners in the air than the miners were. So if the canary got sick and dropped dead, you ran as quickly as you could out of the mine so that you wouldn't be next. So that's the metaphor we're going to work with, the canary. Or maybe it's a simile, but the brain is the body's canary, meaning that the brain it will respond to derangement in almost any organ in the body by becoming encephalopathic, by refusing to work quite right. And that's why when really trying to work up delirium, you're really looking for a problem almost anywhere but the brain, most commonly. So delirium, what it looks like, it's an acute confusional state, and it has certain traits that are always there: fluctuating mental status, so you need some history, inattention, and either disorganized thinking or a change in level of consciousness. That's one definition. That's sort of a practical definition, a mental status definition. And another definition is it's a neuropsychiatric syndrome characterized by an acute change in arousal and cognition resulting from underlying medical insult. So really there are two parts to a delirium workup. One is to first establish that it's there, and second is to try to figure out what's causing that change. So I have an interlude. I've never seen anyone actually show an interlude of a delirious patient, but I had the good fortune of caring for the 90-year-old mother of the wife of a man I'd care for when he was dying of cancer.